All right, good evening. Welcome, everybody, to the Neighborhood Passions Affinity Network, presented by Google, Piedmont, and of course, Neighbor to Neighbor. I'm Valerie O.T. Nellis, and I'm going to be your host this evening. So, tonight, one of our key neighborhood passions that we'll be talking about is caring for your neighbors and our special enrollment for affordable healthcare plans. So, do you all have any neighbors who maybe have lost their job during this pandemic? Perhaps more who simply don't have good healthcare insurance? Well, now's the time to act. This special enrollment opportunity is upon us, the Affordable Healthcare Plans, and we're here to talk about that with Tony Garr. And as he said, he has been a volunteer navigator. I'm going to let Tony tell us a little bit more about himself. Tony?
Well, thank you. I appreciate this opportunity to talk with you tonight. And just some background information. I was a former director of the Tennessee Healthcare Campaign, and now I'm a volunteer. And so I volunteer helping a lot of different things about the organization. And one of the things that I've done actually since enrollment started in the Affordable Care Act in 2014 is I've helped people enroll. And it could be not just the Affordable Care Act, but also TennCare. So it could be cover kids. So we can help people get enrollment in all those health insurance programs.
Fantastic. So tell us about this special enrollment.
Well, ordinarily, enrollment for the Affordable Care Act happens between November 1 through December 15th. So every year, November 1, enrollment starts. And it starts so that coverage will start on January 1. But because so many people have lost their jobs, they've lost their health insurance, they've had to go on unemployment, uh, then President Biden has opened up a special enrollment period. He opened it up until May the 15th, but now it has been extended to August the 15th. And what I mean by special enrollment period is that there's a lot of different reasons why, if you are uninsured or your insurance is just um, maybe costing you too much because you signed up for Cobra, because as you know, Cobra many times is very expensive.
Mhm.
You can take the option to sign up for the Affordable Care Act, which I guarantee you is much cheaper than what you can find on the marketplace. And so between now and August the 15th, this special enrollment period is open. And let me give you one example. If you have received unemployment uh, anytime in this year, 2021, you are eligible to receive the best benefit you ever thought you could have. You can get a plan that has a very low deductible, low copays, and very good coverage. And once again, the thing to remember about anything in the Affordable Care Act is pre-existing medical conditions do not matter.
That's
We,
good to
we
know.
don't ask those kind of questions.
Mhm.
We simply say, are you uninsured? Did you lose your health insurance? Um, and you could be working and the employer not offer health insurance. Once again, you can get into the Affordable Care Act. Or you could have Farm Bureau coverage, which is really not insurance, but it's very limited coverage, and you could get rid of that and sign up for the Affordable Care Act and get very good comprehensive coverage. When I say comprehensive, it has 10 essential benefits from prescription drugs to hospitalizations, emergency care, prenatal care, pregnancy care. It has it all, and there's no uh, extra charge for any kind of medical condition you may have. And many services under the Affordable Care Act are free, listed under the preventive health services. So if you are uninsured, now's the time to really look into it. And the best way to do that is to call our 844 number. You can call 844 644 5443. And if Andrew doesn't answer the call, he will get back with you within a day. And we do it all over the phone. So you don't have to go to it used to be that we would enroll people at the public library. And we had navigators such as myself and certified
Mhm.
application counselors at these public libraries, and between November 1 through the middle of December. But now we're doing it all over the phone. And this special enrollment period, you can do it all over the phone by calling that number, the 844-644-5443.
Excellent. So it goes into August, then it'll close, but it will open back up again in November.
Right, it will.
Okay.
Sure will. Mhm.
And the only criteria around eligibility is you have been unemployed and you don't have and don't have insurance.
You don't have insurance.
Yeah.
You don't have insurance. Now, there are people who, and once again, there's things that are happening this year right now that will not happen in November.
Mm-hmm.
Suppose you got unemployment and you got unemployment only for one day in January of this year. You can actually sign up for the Affordable Care Act and get coverage the entire year. It doesn't matter what your income is. If your income is maybe since that time you've got a job, you're working, it really doesn't matter. You're going to be deemed what they call deemed eligible for having coverage, and you're about 138% of poverty. And what that means is a fancy word, you're making, say, less than $17,000 a year. You can actually get very affordable coverage, low deductibles, low copays, and actually zero premiums. And so good coverage, and that's something that will not happen in November. So
Mm-hmm.
so take advantage of this special thing, because President Biden has really put into the rescue plan this extra money so that people could get health insurance, especially during this time of the COVID. People are scared, they're concerned. Insurance is complicated. You know, they think it takes a lot of time. Actually, by calling that number, you can go through over the phone, get enrolled into a good plan, probably in less than 30 minutes. So
I'm so
Can I
glad
add
you have a
something to that?
phone number. Oh, did someone say something? I'm sorry.
Yeah, it's Andrew. I was just going
Yeah.
to add something to it. One of the features, I think it was just Tony had it a little backwards. The best way to think about it is, sorry, Tony, but all I'm going to say,
okay.
maybe so they'll realize this better. If you're on unemployment for even one day this year, no matter if you, because for one person, you got to make at least $13,000 to get help paying for coverage. But what Biden signed in was even if you were on unemployment for a day during this year, but you're not going to make $13,000 a year, you're still going to qualify for the health insurance, for the
Okay.
help paying for it. That's the key feature of all this,
Okay.
because it's never been like that, and it won't be like that next year. It's just this year that we got that passed through. So in fact, I helped someone earlier today that was on unemployment for 2 weeks in January and got taken off, and she can still keep her plan.
Mm-hmm.
And one of the benefits off us is the healthcare campaign, Tennessee Healthcare campaign became a nonprofit insurance agency. So we are contracted with all the insurance providers. So instead of like having to, I don't know if you guys have ever called an insurance company and just sat on hold and you got rerouted 3 million different ways and it's just a big headache. All our clients have to do is call me or Merrill Rice and we can get into their system because we're contracted with them and solve any issues with billings. I scheduled some surgery yesterday at St. Thomas Rutherford, and it's just a huge highlight. All our consumers love it. They create personal relationships with us, and that's the idea of our program.
Right. So they enroll this year and you have to re-enroll next year. Is that correct? And
You have the opportunity to enroll. In other words, once a year you can change your plan, or if you're uninsured, you can sign up starting November 1 ordinarily. But now, because of the special enrollment period, you can enroll now. And what Andrew was alluding to is something very important, that like if you have this unemployment just for a week or a, you know 2 weeks or 2 months, it doesn't really matter. You are deemed eligible for the Affordable Care Act, and there's no what we call the coverage gap. The coverage gap, ordinarily, if you're less than 100% of poverty, you would be covered by Medicaid. But in Tennessee, since our state did not expand its Medicaid program, you're not eligible for this extra help and for this premium assistance and cost sharing reductions. But because of this special enrollment period right now, there are some special rules that apply and that make it a lot easier for a lot more people to get coverage. You may have heard there's been an announcement just over the last couple of days. 1 million Americans across the country have taken advantage of this special enrollment period so far.
Mm.
And so I don't know how many of those are from Tennessee, but hopefully it's a bunch of them. So,
I did about 900,000, I think, Tony.
Oh,
okay,
wow.
great. Thank you.
Oh, my
No,
goodness.
I'm playing sarcasm.
That's tremendous. Does it include dental insurance or is just health?
There is a feature on it. I do sign up people for dental. We have Humana. We can do, like, we're contracted with the insurance carriers. So we can, like, if you pick a Cigna plan, I can sign you up for a Cigna dental. That's not offered on healthcare.gov, but I can do it. Or we can pick like a Humana plan or a Dental Quest or something like that on healthcare.gov to where you can select a dental.
I might add, ordinarily we think of this if you have individual coverage and that you might think, well, I have coverage, I'm not eligible. But if you have individual coverage, and help me here on this, Andrew, I'm pretty sure you can give up individual coverage and get on the ACA and get the premium tax credits in that.
What do you mean
Now,
by individual coverage?
well, I mean, you can buy individual coverage in the marketplace and go to the Farm Bureau and buy coverage.
Yes.
It's not insurance, but you can get individual coverage. And what I'm simply saying is you can give that coverage and sign up for the Affordable Care.
Yes, you can do that.
Another thing that's special, let's just say it's May the 29th and you need your coverage to start soon. Your coverage will start on June the 1st. So there's not this long waiting period. But if you sign up on May the 1st, you have to wait till June the 1st. But as long as you sign up anytime that month, it's going to start the first day of the following month. So your coverage can start pretty quickly. It used to be that you had to sign up by the 15th of the previous month to have coverage the first of the following month. This all gets a little complicated. And, if it's confusing, okay. I've been doing this for many years and it's still confusing. So, but once again, that 844-644-5443 is just an important number. You can send anybody to that number and we can help them figure it out if they're eligible.
I'm so glad it's a phone number, I tell you, because there's a lot of folks who really don't navigate the electronics, the computer well. So it's fantastic that there's a phone number to call. Is there any way to know, I don't know, a ballpark of what the fees would possibly be? I suppose it varies, but
yeah, actually, if you we also have a website for this new program. It's at www.insurealltn.com. And on that website, you can actually you don't use healthcare.gov, but you use a health Sherpa. And if you just put in your income for the year, you can even see how much tax credit you're going to get. You can see all the plans that are going to be there for you. And you can even fill out the application and just call the 844. I had someone earlier today call because they got on our website, they did the entire application, and she said, I just need someone to explain to me what all these things mean on the insurance. So I just talked her through it and helped her pick a good plan. And she actually ended up getting an and better plan that includes dental and vision.
okay.
That's one of the new things that happened this year. We got a provider that offers vision and dental all included into the same plan. And she was able, I think her total cost for her and her husband was $2.58 a month.
Wow.
That's full coverage. She has a $75 deductible, but she has copays. So her copay for doctor visit was $5. Generic drugs was no more than 10, and a specialist was only, think it was either 10 or $15.
That's pretty amazing.
Yeah.
For college students, do they have to, does the parent have to be on it, or can just the college student be
If
on
the
it?
college student has employment or has income, they will want to do it on their own, but the parent can still claim them as what's known as a collateral dependent. And the parent can claim the child. Now, if the child makes more than $9,000 a year, the parent isn't going to be able to do that for the tax credit, but the parent can still claim the child. Or I have a lot of college students that just have part-time jobs as servers and stuff, but they're still making $13,000 a year. So we're able to sign them up for an awesome plan for basically nothing a month.
Mhm.
And
That's
just to add
really-
to that, if that college student's received any unemployment
Right.
during this calendar year,
Mhm.
they're actually they're deemed eligible no matter what their income is.
Correct.
And so
Mhm.
that's another reason why this special enrollment period is really special.
Yeah, that is very special. Really special. Oh, right. Now, how can my neighborhood leaders, I guess the best way for them to be advocates for this, or for their neighbors, um, what do you, what is kind of the best way to kind of encourage people to, get people involved?
Just call me up and talk to me.
Mhm.
I always tell people our best advertising is word of mouth, because it is. I
Yeah.
mean, I help one family and I'm talking to the brother or sister the next day. Then I'm talking to a friend the following day. Then I'm talking to a friend of a friend of a friend. It's our
Mhm.
best advertising, and we're here to help. I mean, we're not a business. We're not doing this as a business. We are getting commissions from the insurance carriers to help the nonprofit, but we're not business minded. We're just
Okay.
here to help people, because we also do tin care. I do kind of consider myself a tin care specialist. I can do tin care, QMB, SLMB, Q1, choices, anything. I've been trained on how to do it all. So I'm always here just to answer any questions people have, and they're always going to get me if they call the 844.
Now, this is really, again, a really special situation. I mean, how do we advocate with our lawmakers that we need these kinds of things? Um,
Yeah, well, that's something that the healthcare campaign has been working on this since 2014. As you may or may not be aware, under the Obama administration, with the creation of the Affordable Care Act, uh, President Obama wanted every state to expand their Medicaid program.
mhm,
Uh, as the ACA was passed in 2010, but in 2012, the Supreme Court decided that states had to actively choose to expand coverage. And 38 states and the District of Columbia have decided to expand their Medicaid program to cover every income group, low income, whatever. Tennessee is one of 12 states that have chosen not to. So when you ask how to advocate, and it's one of the things that we work on, and we talking with our state legislators to get them to expand the Medicaid program. And then this gets very complicated, but this year, President Biden has provided states with enough money where they could actually do the expansion, cover 300,000 uninsured Tennesseans who are single adults they're not parents of children, they're not disabled, so they don't fit into a traditional TennCare program or TennCare
mhm.
category. And, there's enough money in there where Tennessee could do that without one new tax dollar for 6 years. Tennessee still has not chosen to do that. So it's an ideological battle that we're struggling with right now with our state legislators.
In
Mhm.
fact, they're trying to block grant it all. So,
Mm.
they were given the opportunity and they're trying to take it away
Yeah.
even more than
So
already exists.
we need to talk to our legislators about supporting. That's what I'm hearing. Is that right?
Yes, we certainly
Mhm.
do.
Okay.
And I might say that most all the state legislators here in Davidson County do support it.
Mhm.
It's once we get out into the rural Tennessee areas where we're having more difficulty convincing state legislators that we need to do this.
What do you think is why do you think that is? In
I
that
really,
rural
there's
area?
no good logical reason. There's no financial reason. Like I said, it doesn't cost the state a penny to do this. It's really ideological. And when I've talked with state legislators, and I've talked to many of them, I can't say all of them, but many of them, or I can say most of them, but their reason is that they don't want to expand a government service. they think the private enterprise should be doing this,
Mhm.
and they are opposed. And this goes down from the Governor Lee to the Speaker of the House, Cameron Sexton, to the Lieutenant Governor, uh, uh, Randy McNally. So
Mhm.
it's really ideological, and it's going to take a lot of work to get them there. So
Right.
we're just not there yet.
Audience, you all have any questions, things that I haven't posed to Tony or Andrew that you're curious about, need to know?
Um, I have a question, or I have several questions, but
Mhm.
I think, I'm dealing with a lot of people who just don't fit into these certain categories like you were talking about, Tony. And so maybe you just answered the question already that they can't get help. But like I'll have a dad who has, let's say a dad who has joint custody of a child, right? But the mother lives out of state, who has the custody during the school year. And so the mother lives in Kentucky, for example. He lives in Davidson County and say has the child for the whole summer and needs coverage
Mhm.
as well. So they have joint custody, meaning they both can get medical. They both, have control over education and the whole thing.
Mhm.
So when I was talking to him, he seemed to be having a problem because they always go back to, well, what's the child's address?
Mhm.
And he said, well, he's with me, but he's like, well, no, where is he really, So I don't know,
Can I answer this?
Let me answer that question, then Andrew can correct me when I finish. If you're a Tennessee citizen just for one day and you declare Tennessee your resident, you are a resident of Tennessee and you're eligible.
Oh,
And you don't have to live here for 6 months. But if he's here in Tennessee, say just for the summer from June to August, I think undercover kids, he could get coverage. Andrew, is that correct?
Yeah, well, it's correct and it's not correct because technically, um, whoever claims the child on their taxes is the guardian that TennCare is going to see. But see, one of the highlights of the healthcare campaign is we have a part. Well, I don't know if you call it a partnership, but I work with the TennCare response unit, and they're the higher ups of Medicaid system. And so if I can explain to them the situation with the father and the mother, and I can make sure that that kid's covered while the child is in Tennessee. There is no clear way to do this on your own. And it is a great feature for nonprofits because we're here to help people with that type of situation that the state can't do it. I mean, if they call TennCare and try to sign them up, they're going to get booted off. But I work so well with the response unit that they'll understand the situation. I can get it put in front of a judge and done with within 48 hours.
oh
So
wow.
yeah, just send them to me, send them to the 844, and I promise you I can take care of it.
Okay.
And that's not
That
Tony.
answers,
Go ahead, Carol.
I think that answers the other questions, which was similar. Well, maybe it doesn't. So I deal with a lot of grandparents as well who have similar, but I don't know if that doesn't
Yep.
fall to the same category because they're not considered, joint custody, but they may have the grandkids for a summer, or they may have, so it's
Oh no, that won't work the same way.
right,
Yeah,
because they're not
unless they have temporary custody, they
parents.
can deem them like if the kids always come to the grandparent for the summer, you
Uh-huh.
can get temporary custody for 3 months or whatever. You might see if they can do that, and then we can insure them into TennCare.
I see. So it's a matter of the custody
Yes,
status.
yes, but the temporary custody will work.
Okay, got it. Um,
Carol, just a quick question. Do the grandparents have health insurance?
yes,
Oh, they do. Oh, they're covered. Okay.
but they can't add the children because it has to be a dependent to add to their policy.
Well, Andrew's correct. The best thing to do is just call 844 and you just talk directly with Andrew and see what he can work out.
Mhm. Okay, and the last question I have for you is in terms of, um, like gig workers or people who work off the books, and like what type of documentation is needed in terms.
Uh, Yeah, for that, I mean, they're gonna have to pay. This is what I always tell people: they're gonna have to pay taxes on at least $13,000. A lot of people that just kind of work for cash and stuff like that, a lot of them don't file their taxes. The difference in you're going to get great health insurance. I mean, amazing health insurance. It saved so many people's lives. I can't even tell you. But all I have to do is I explain to them, look, just go to Walmart. January 1st, they had those people that do tax prep for you. Just say, hey, I need to claim that I made $13,000 from babysitting, from working, from selling at a yard sale, whatever they do to get money, and then they can qualify as long as they pay. I think it's usually about $950 worth of taxes, but believe me, they're getting more than $950 worth of health insurance costs. I mean, it's saving so many people's lives that just they never realize, hey, I have to fill out my taxes.
At that level of income, they're probably not even going to pay that much taxes. So,
Right.
They may not. I remember I was helping a taxi driver get enrolled in the Affordable Care Act, and we were over at the library over in the Antioch area, over at Southeast, whatever. And he came in and he gave me a tax form, and he took all these deductions from his car to the gas to all the other stuff. And it showed he only had income of $5,000 a year. And I explained to him that he had to make at least 13.
Right.
He went back to his tax accountant. He decided he wasn't going to take all those deductions as a self-employed person, and came back and we got him enrolled. So that's the trick. There's this coverage gap because our state did not expand its Medicaid program. But once again, it's just a matter, we can try to help work with folks and see if they can make adjustments so they can qualify.
A lot of people don't realize how much health insurance costs. I mean, for the average 60-year-old, you're talking it's going to be more than $1,000 a month. But with this new thing that Biden let through, a lot of these people aren't making a monthly premium. I mean, they're not making a payment. The government's giving them more than $1,000 a month to help them pay for it. So it's really amazing what's going to go on this year and next year. We just got to make sure everybody takes advantage of it.
Absolutely.
Thank you.
I have a question.
Yeah. Any other questions?
Valerie's locked up, so let me go ahead and
Yes.
take over for a moment. Yes, go ahead with your question.
Yes. Okay.
Okay, so my grandson aged out of TennCare. So he has not had insurance for 3 or 4 years. So whatever medical that he has, I pay it out of my pocket. So I've been trying to get him to sign up for insurance. Is it any way that I can do it instead of him if I provide you with the information that you need?
Yeah, I mean, as long as, so he's your child?
It's my grandson.
Grandson? Yeah, I mean, I'll work with you. I usually just need his verbal consent that it's okay. That's what I usually get if it's an adult. If they just say, yeah, it's okay if you talk to my grandmother or my mother to work with him, it's fine, we can do it. They don't, because I have a lot of 20-year-olds that I work with their parents because they don't know how to answer the questions. They don't know. I mean, when I was 20, I didn't know all the details of health insurance. So I don't expect them to know it. So I usually work with a mom or a dad, and it's, just do it that way. But yes, we can. I just have to have a verbal consent from them.
Okay, thank you.
So Deborah, you have the 844 number down? Did you write that down?
I did. I take
There you
good
go.
notes.
Yeah, right.
I might say this, that I'm new to neighbor, so I don't exactly understand your structure and how your neighborhoods meet. But Andrew or myself, if you have Zoom meetings, or you zoomed out or whatever, just with your neighborhood group, and you want us on for 10 or 15 minutes to maybe try to do a truncated version of this, we'd be glad to accommodate you, whatever we can do.
What a great idea. Thank you so much for that offer. That's a great idea. Yeah.
We have another question that's been typed in.
Okay.
Does a child have to be in college to get the insurance?
No, no. You just have to, the whole object of it is you have to claim the child on the adult's taxes. As long as a child can be a dependent until it's 26. As long as the parent's claiming the child, you can use the parent's income. If the child's working, then you're probably going to want to use their income and just claim them as as a single person. I'm sorry.
One of the things I would add to Jim's question is if this child was a foster child, they're eligible for TennCare until they're 26. So this is sort of another weird thing. Ordinarily, you would never read that. But if they received foster care and they aged out of foster care,
it's foster care in the state of Tennessee.
they can get TennCare until they're 26.
But this extension is nationwide. It's not, and this offer is nationwide.
No, I just meant the foster care. They have to be in foster care in the
here in Tennessee. Yeah.
They were in foster care in like Illinois, but moved here. They're not going to be able to be on the Medicaid.
Oh, okay. All right. Very good. This is fantastic information. I know a lot of people who could be impacted by this. Well, do you all want to add anything? Is there anything we haven't covered that you think we need to know?
Well, the important thing is if you have questions and you're not sure about enrollment, once again, call the 844-644-5443. Call that number and we can help you, go through the numbers and go through different scenarios to sort of see what avenues may be open. So it's complicated. Don't feel stupid. There's no stupid question as far as health insurance. It's complicated.
I promise I'm the only one that answers it. And I promise you, I've heard every question. I've been doing this 7 years. I've heard everything. So but we have a lot of funny conversations too, because,
I have another question. Are there any programs that provide kind of supplementary care? I also have a woman she's a senior. She broke both of her legs at the same time. And so she chose not to stay in a rehab facility because she wanted to be at home. But because she chose to stay at home, Medicare won't cover her. So she's not in the Medicaid category.
Well, she is in the Medicaid category because she's either on QMB, SLMB, or spin down. And if you can get LTSS, it's long-term services, and that's part of Medicaid. And that's typically how TennCare pays for the like nursing home care. But you can, in fact, I've done this for many children that are born, premature and stuff like that. They have in-home nursing. If you go on our website, you'll hear a story from a lady I helped with her child in this exact same situation that you're talking about, because they wanted to put this child in a nursing home, and because the child was, very ill, and I was able to get TennCare to approve the LTSS for the in-home care, and now the child has 7 days a week of 8 hours a week, 8 hours a day of a nurse in the home caring for the child.
Okay, so that's not an income specific.
It is, but it isn't, because the spin down, I know I just said it, but I can use their cost. Anything that associates with the cost of their health associates to what we call spin down. So like the amount of money they're having to spend for even Advil, that can count towards their spin down to bring them into the category. I've brought people that make $120,000 a year down to the level to get Medicaid just off of spin down.
So that's my question. Yes. Okay.
So you went through a bunch of acronyms just a second ago. Could you kind of tell us what those acronyms are?
Yeah, I'm sorry. QMB is for Medicare, people who receive Medicare. And what QMB does is it stands for Qualified Medical Beneficiary, and it pays for the supplemental insurance for Part B and D. It will not pay for an Advantage plan. but it will pay for the cost of the supplemental for B and D. SLMB's the same thing, but it's for people that make a little bit too much for QMB, but it will pay for the medical, but not the prescription. Q1 it's a qualified individual, and it will pay for the working disabled. Because the working disabled, like if you're disabled or you become disabled at like age 20, but you start working again and you make enough money that you're going to be kicked off of Medicare, you have 8 years to build up, and they give you that 8 years to build up income to make sure that you're good to go. You're not going to fall disabled again. That's Q1. Which other one was it?
Mhm.
LTSS is the long-term services, and LTSS is for nursing care or nursing in the home. And I'm sure there was other ones, but I just can't think of them.
That was really good, though. A lot of those are very
Okay.
important services.
Yeah.
So I
Go
can
ahead,
have her
Karen.
call, Tony or you, Andrew.
Yeah. Anytime. I'm the only one that's going to answer the 844. So you never have to worry about who they're going to talk to, because it always just goes to me.
Mhm.
Hey, Andrew, I've got a question. My name's Andrew as well. I think we've actually exchanged a few emails in the past. Where can a person go? I'm an insurance agent too, by the way. Where can I go to get some more in-depth training on those programs? I've read quite a bit on the extra help programs. I help people apply for them. But I wouldn't call myself an expert in those extra help programs, and I'd like to know more. Where can I go to learn about
The
those?
Justice Center does a lot of training on them. That's how I kind of got into it. I really dove into all their training programs and stuff they did. TennCare does do their own trainings for, typically they do them for health departments, but if you talk to your local health department, they'll be able to hook you up with the days and stuff that they're going to do it. I mean, I can even offer you guidance on them. I can do a PowerPoint with you on a one-on-one, because there's a lady that works for TennCare now. I don't know if you know her. Her name's Kathleen Kennedy. She really trained me on how to do all of TennCare, and she actually works for him now with the response unit. And there are people at TennCare that will help you with all the understanding of all, because there are a million different categories for people that a lot of people don't even know about.
Is this Andrew Bennett? Andrew?
Yes.
Oh, from Loudoun County.
Yes.
Yeah, how you doing?
Good.
Good. So good to see you. Good to see you.
You too.
Very good. Very good. All right. Any other questions?
Yes, what was the website I got? Insureall.tn.
It's insurealltn.com. I'll type it into the chat.
You can also get the Insure TN from the Tennessee Healthcare Campaign website, which is tnhealthcare.gov.org.
I just want to, while you all are talking about chat, as we're getting near the end of the time, for those of you who are unfamiliar with some of the bells and whistles in chat, we put a lot of stuff into the chat tonight. If you go down to your bottom and you'll see there's 3 little dots down there. And if you hover over it, it says more. If you click on that and say save chat, it will download the chat as a text file onto your computer that you can open up later on and refer to as well.
So where are the 3 little dots, Jim? By the chat, or where are they?
Yeah, if you look and you'll see it says to, and usually it says everyone. And then you keep going over, it says file, and then finally there's 3 little dots down there.
Oh yeah, right
And
there.
it says
Okay.
save chat's the first option.
Right.
If you click on that and do the save chat, it'll allow you to download the chat. It'll go to your download folder, and you'll be able to open that up as a text file.
And I also want to tell you guys, if you guys go to the insurealltn.com, make sure you check out the videos, because we have one on there where a couple years ago, I was able to get me and a bunch of people invited to Bonnaroo, and we passed out information, condoms and information, but it was great. It was a lot of fun. You'll have a good time watching those.
Sounds like fun. All
It
right.
was
Well,
a blast.
Well, thank you so very much, Tony. Thank you, Andrew. We really appreciate you all being here this evening and really helping us understand this opportunity that's been afforded us. Thank you, audience, for your wonderful questions and comments. You always do a fabulous job. Again, hey, if you have not signed up for C4N, it's not too late. Please do so. We're going to have a great time this weekend. Please join us next week when we will have Mike Hodge, who's going to be talking about effective organizing. And I think that'll be a really great program as well.
If you don't know Mike Hodge, Mike worked for our organization for 17 years before moving to NOAA. He knows neighborhoods.
Yeah.
And he is one of our top rated workshop leaders. So if you get a chance to hear him, you always, whatever he talks about, he's always an impressive person to listen to.
Yes, he really is. All right, remember, great neighborhoods don't happen by accident. Find your neighborhood passion and work hard to make your neighborhood a safe and vibrant place to live. Thank you all. Have a good night. See you Saturday. Bye.
Thanks, Tony. Thanks, Andrew.
Thank you, Tony.
Thank you, Tim.
Andrew.
Thank you.
Bye.
Enjoyed it very much. Thank you.